5 moments for hand hygiene approach was designed by World Health Organization to minimize the risk of transmission of microorganisms between a healthcare worker, the patient, and the environment. Let's see what are the 5 moments for hand hygiene. The first moment is before touching a patient. Examples are before doing clinical observation of a patient. For example, blood pressure, temperature. Second example is before helping a patient to get up from the bed. So these are the examples of before touching a patient. Moving on to the second moment for hand hygiene, that is before doing an aseptic task. We need to clean our hands immediately before doing any aseptic task or doing any sterile procedure. There are many examples. One example is replacing a dressing, and another one is when we are before handling the peripheral line, central lines or arterial lines, we need to clean our hands to protect the patient against harmful germs, including the patient's own, from entering his or her body. Here comes the importance of hand hygiene. So as nurses, we need to ensure that we do hand hygiene before doing any aseptic procedures. Moving on to the third moment, that is after a procedure or body fluid exposure risk. We need to protect ourselves and we need to protect the patient. So we need to make sure that we do practice hand hygiene. There are many examples. One example is cleaning patient trolley. So there is chances for contamination of body fluids such as blood, urine and all. So we need to do proper hand hygiene. And another example is when changing a soil bed. Moving on to the fourth moment, that is after patient contact. We need to clean our hands immediately after touching a patient or his or her immediate surroundings to protect ourselves and to protect the patient. The examples are after taking the clinical observations, for example, after checking temperature, blood pressure, oxygen saturation, or after close contact with the patient or after touching a patient. So we need to make sure that our hands are clean so that we will prevent the healthcare associated infection. Moving on to the fifth moment, that is after touching a patient's surroundings. So we all know as healthcare professionals, we need to practice hand hygiene during these 5 moments. Example for the fifth moment are after touching a patient's bedside table, or after tidying a patient bedside table, or after tidying a patient bed. We need to make sure that our hands are clean so that we can prevent the healthcare associated infection. Remember, clean care is safe care. The hand hygiene, that is the most important measure that helps to prevent healthcare associated infections.